Ladies and gentlemen, thank you very much for giving me this opportunity to present our data. Here I'm going to present a novel and successful CD7 gene knockout CAR T-cell therapy for refractory relapse T-cell hematological malignancy. I have nothing to declare. T-cell malignancy represent a group of hematological malignancies with high relapse and mortality rate. The shared expression of a target antigen between CAR T cells and the malignant T cells has limited the development of a CAR T due to unintended CAR T fratricide. We have developed a fratricide-resistant anti-CD7 CAR T modified by CD7 ablation through CRISPR-Cas9 gene editing we call the KO7 CAR. Here I'm going to report our phase 1 data regarding the efficacy and the safety of KO7 CAR for refractory relapse T-cell malignancy, which including TALL, T-cell lymphoblastic lymphoma, and mixed phenotype acute leukemia. KO7 CAR is a second generation of CAR. It's murine-based with 4-1BB as a co-stimulator. This CAR was derived by electroporation of bulk T cells with CD7 targeting Cas9 gRNA RNP 24 hours before CAR transduction. The KO7 CAR T cells were typically harvested for infusion between day 14 and day 21. As a matter of fact, we for our preclinical study, we used 3 different approaches to generate anti-CD7 CAR T to see which method is the most suitable for clinical trial. For this part of results, we already published in recent Blood. One is we call the NEX7 CAR. It's a CD7 CAR transduced from purified CD7 negative T cells. 2 is NS7 CAR, which is natural selection of bulk T cells transduced with CD7 CAR. 3 is the transduction of a CD7 CAR into bulk T cell ablated for CD7 by Cas9 RNP gene editing. For the comparison, both KO7 CAR and NS7 CAR showed comparable cytotoxicity and released high level of gamma interferon and TNF alpha, but NEX7 CAR to a lesser extent. Both KO7 CAR and NS7 CAR confer robust protection against the leukemia progression with a marked reduction in leukemia cell burden in our mouse animal models. So with those preclinical data, we then opened clinical trials, phase 1 clinical trial, both for NS7 CAR, the results already published in recent Blood, and another one is KO7 CAR. I'm going to talk about detail here. From October 2020 to October 2021, 15 patients was enrolled. 10 patients with a TALL, 3 patients with a T-cell lymphoblastic lymphoma, 2 patients with a mixed phenotype acute leukemia. The median age was 28 years old, from 8 to 46 years old. The median bone marrow blast was 12 all the way up to 61%. 9 patients had extramedullary disease involvement, including 7 were diffuse, 2 was a bulky. 4 patients had a prior allotransplantation. 1 patient even had 2 2 prior allotransplantation. One patient with MPAL had a prior CD19 CAR T therapy. Median prior therapy was 5, and 2 patients had a STIL-TAL fusion gene. 1 single dose CAR T cell was infused. 8 patients received lower dose. 6 patients received medium dose, and 1 patient received high dose. We have a 100% manufacturer success rate. Either CAR T cell can generate from patient's own peripheral mononuclear cells or from their allotransplantation donor, with a median transduction efficiency 59%. Here come with our clinical outcome slides. The median follow-up time was 309 days up to 407 days. On day 28 evaluation, 15 out of 15 patients achieved MRD negative CR/CRi in their bone marrow and peripheral blood. Among the 9 patients with extramedullary disease, 6 patients achieved the CR, 2 patients achieved the PR, 1 patient who relapsed after 2 prior allotransplantation had no response for the extramedullary disease. 12 patients subsequently had allotransplantation after CAR T therapy, with a median follow-up 253 days. Up to 388 days after a transplant. 11 patients still remain in CR and doing well. 1 patient with a STIL-TAL1 fusion gene relapsed on day 217 and was found to have CD7 lost. 2 CR patients died, 1 from infection on day 78 and 1 from GVHD on day 103 from CAR T, after CAR T. Both patients are heavily pretreated, had a prior allotransplantation before CAR T. As a matter of fact, they had a short relapse after transplant. 1 patient was relapsed less than 3 months from the allotransplantation. The other was 4.5 months after allotransplantation before CAR T therapy. Regarding the safety, CRS occurred in all patients. However, a majority of patients only have the grade 1 or 2 CRS. 5 out of 15 patients had a grade 3 CRS. 3 patients developed neurotoxicity. 1 was a grade 1, 1 was a grade 3, another one was a grade 4. However, no deaths related to this CAR T therapy. We've been carefully monitor patient peripheral CAR T cells proliferation and persistence, both by qPCR and by flow. The median peak level was reached on day 20 by qPCR, and the median peak circulating CAR T cells was 63% per flow cytometry. So in summary, this study demonstrated KO7 CAR had a high efficacy for treating CD7 positive T cell malignancy, including TALL, LBL, MPAL, even for those who relapse after transplantation or with extramedullary disease involvement. When relapse, loss of CD7 expression was observed. Patients with STIL-TAL1 tend to have a poor outcome. The safety of the CAR T therapy are manageable. Certainly, long-term observation are more patients are warranted for further studies. Here is our acknowledgement. KO7 CAR was provided by Hebei Senlang Biotechnology Company, and the clinical trial was conducted in Ludaopei Hospital in China. Thank you very much for your attention. And